Well, the idea behind EvidenceNetwork.ca is to take the 800 pages of data driven from researchers and turn it into 700 words of pithy opinion and market it out as op-ed pieces across Canada. And it all started as the brainchild of Dr. Nora Roos at the University of Manitoba. She started to work with these academics and worked with them in ways to sort of get these research pieces put into op-eds and published in mainstream media. And that was her little brainchild about 6 years ago. And it's grown in a tremendous way to the point now where I'm taking it over at the University of Winnipeg. I started it up in April, and we've seen over 800 op-eds that have been published so far this year for Evidence Network, and the numbers are growing on a daily basis. Well, I can give you an example. I got a SHARK grant a number of years ago in order to produce a longitudinal analysis of women politicians and how they're depicted in the Globe and Mail as leadership candidates. My other researcher, Linda Trimble at the University of Alberta, we worked really hard in getting some data sets put together, and we had an opportunity to present our findings at the University of Tampa. So we traveled to Tampa. We worried about our 10-minute talk that we were going to do. We got all gussied up for it. We went to the talk, and one person showed up for the talk. That's an example of what happens an awful lot at academic conferences. We did publish the piece. We have no understanding of whether more than 5 people actually read the piece. But when I actually publish an academic article as an op-ed in a piece across the country, I know that people read it because I get feedback right away. There's also, though, a public service requirement. I am funded, for the most part, by taxpayers. And so taxpayers have the right to see the type of work that I'm doing. And when I publish in an op-ed, they get that opportunity to see it. We'd like to do anything that is evidence-based. We are not going to do anything that is ideological. It has to be evidence-based. Since I've taken it over in April, I've tried to broaden it a bit more, not just to healthcare, but to social justice issues, and increasingly towards the sciences and research-driven, evidence-based pieces as well. I think that it's important that we have an understanding of what the Canadian scientific community is doing as well, and all of our important science and research institutions across the country, what they're doing. We're opening it up in very exciting ways at Evidence Network. As long as it's evidence-driven, we're excited to take anyone's pieces. But we don't just do op-eds. We also do media backgrounders. Gino DeStasio here, our VP Research, has worked extensively on housing strategy. That's the type of information that we put together at Evidence Network, and it's knowledge mobilization at its very best. We allow, too, for a diversity of voices. Very often women are a bit cautious about approaching the mainstream media because they never know where it's going to end up. This wonderful way of doing it is by doing an op-ed because they can control it from beginning to end. They get to see the finished product before it appears in the media. They get to control the voice because it's their voice and it's in their voice. Sometimes we get government to pay attention to things that they were not aware of, and sometimes we get government to change their minds on policy that maybe has some unintended consequences that they weren't aware of. We had a wonderful example of this. Helen Reese, as an individual who has been working very, very hard and trying to change the Ontario government's cap on funding for children with disabilities. And she had done all the right things. She had met with politicians, she had gone to all the right committee meetings, she had done the work behind scenes, and she had seen no type of changes at all. She wrote an op-ed. The op-ed got published, and then she was informed that suddenly the policy was being changed. Now, all that glad-handing she had done behind the scenes and all the meetings that she had done behind the scenes didn't hurt, but the op-ed was the tipping point, and she credits Evidence Network for that tipping point. We do know that Evidence Network has changed policy, and it's important for that reason.